Hello, my name is Rebecca Flowers. I've been an occupational therapist with specialty in pediatrics and in a neurological frame of reference called sensory integration for almost 35 years. I say that by way of telling you that I've had a lot of experience with working with babies and children. And within 4 years of graduation as an OT, I discovered another tool to add to my toolbox of knowledge that has helped me tremendously over the years. It's called CranioSacral Therapy. It's out of the osteopathic community, and it was brought to us, it was popularized in the 1970s, the early 1970s, by Dr. Upledger. It is the craniosacral system that we're going to be talking about is the one system in the body that houses the entire central nervous system. So we're talking brain, we're talking spinal cord. And that being said, there's very little in terms of problems that we have physically as well as socially, emotionally, because all of those things are brain function too. So there's very little that cannot be helped by craniosacral therapy. The premise of craniosacral therapy is that if we mobilize the bones, which, by the way, Dr. Upledger with his team of researchers at Michigan State in the 70s proved there is movement that continues through the lifespan of all of the different bones at the sutures. That's what these wiggly, squiggly lines are called. That movement and that system, that membrane system, is continuous all the way down to the tailbone. And it's continuous from the meninges lining the skull through the hole in the base of the skull all the way down. I'd like to take a minute to talk to you about how craniosacral therapy can help with a variety of different traumatic brain injuries, problems neurologically that have occurred for a number of different reasons. Many of you have a child who suffer from seizure disorder. Maybe if you don't have a child with a seizure disorder, you know of someone else that does, or there's someone else within the family. Maybe you as an adult have suffered from seizures. There's a number of causative factors there, but oftentimes when we look at babies, we look at children, we think in terms of trauma to the brain. So there are, again, many factors besides that can result in seizure disorder, but I'd like to talk about cerebral palsy as one of them. And when we talk about babies, we think in terms of brain bleeds or strokes that can occur either in utero, during the birth process, or shortly thereafter. Cerebral palsy has been classified as any non-progressive brain damage from birth until age 18. It's sort of a catch-all terminology. So, how can craniosacral therapy help that? Well, first of all, if we are working with the mother and the baby, the fetus, throughout the pregnancy, it can often avoid situations where baby is going to be in a compromised position. It can't always help with that, but I can tell you that over the 30 plus years that I have been doing craniosacral therapy, on babies and children who've had brain bleeds or they've suffered from lack of oxygen. Those are the two things that can cause that kind of a problem within the brain. It often results in seizure disorder. And I can tell you that had I had the resources to do a scientific study of craniosacral and its application to seizures, this is the topic that I would have chosen out of all the other topics for working with pediatrics, because I have found in almost every single scenario that it improved the quality of life of the individual. I'll share with you some of those stories, and then we'll go into how does it help. I can recall a child that was brought to me years ago, probably 30 years ago at least. Family drove 4.5 hours to get to the clinic. And they did so because after coming for the first visit, the child, who had had multiple seizures every hour, went to 1 seizure a day as they shifted their sleep-wake state, going to sleep at night or waking up in the morning. That's a huge improvement for that individual. Because if you know very much about seizures, you know that there is the prodromal state in which the individual becomes aware that something is happening. And a lot of times there'll be some anticipatory anxiety because their experience of it is somewhat traumatizing. It's out of their control. We'd feel, all of us, that way when we're totally out of control of what's happening to us. Then there's the seizure itself. Some of them are petit mals where we just lose focus and attention. We're someplace else for a few seconds. To a complete grand mal in which the individual's muscles contract. It can be myoclonic, myotonic. They can bite their tongues. It's not a happy situation for anybody. And then the individual experience oftentimes the postdromal phase, in which it's sort of like being traumatized and needing to sleep it off. Okay? So there's a certain amount of losing their ability to be present. So for a child, that's dramatic. It's very difficult for them when they go to school because they lose a lot of their day. One of the things I'd like you to know from my training and my experience over 30 years is that most seizures are not damaging. If the seizure is damaging, the neurologist will tell you. It's the kind of seizure that we have to do something because they stop breathing and we could have more damage. And it tends to be somewhat progressive that way. But that's not the norm. The norm is that the individual is going to lose some time where they're not present. So even if it's a petit mal, where I just lost my focus attention, or whether it is a full grand mal, there's the situation and the neurologist will say, well, I think we need to do meds because they're losing that amount of time. CranioSacral can help with that. CranioSacral can reduce the frequency of a seizure, the intensity of a seizure, the type of seizure, and I have seen that. I'll give you another case scenario. There was a little boy that was brought to me. I'm in the Palm Beach Gardens area in Florida. That's where the Upledger Clinic is. I've been here 21 years, and over the years I've had children brought to me all the way from Miami, which is at least a 2, sometimes 2.5 hour drive. This child was having what we call drop seizures. So again, many different types of seizures. But the drop seizures were such that even though he wore a helmet to school, every time he fell, it was a sudden, without warning, boom, like someone felled a tree, boom. And he'd fall forward, and when he did, it would push the helmet back. So that his forehead, because he'd landed here so many times, the bone had actually become denser here, and his forehead protruded more than the rest of his skull. This would happen to him a minimum of 6 times a day while he was at school. That's traumatizing. And on top of that, he'd had so many stitches as a result of it that they no longer had tissue to stitch. So they'd have to use butterfly bandage instead. In working with that child, almost immediately his seizures shifted. He no longer had any drop seizures. Almost immediately it shifted such that he too only had a seizure when he would wake up in the morning. That's a dramatic improvement in his life circumstance. And over time, as he grew older, that even got better. What did manifest then were some learning disabilities that nobody could even discern because of the seizure situation. Okay? So when we talk about how craniosacral therapy can help, I want to refer you back to the brain, to the spinal cord. So if we look at that entire system, once again, this is the one system that houses all of the entire central nervous system and has influence over the peripheral as well. So we're talking brain, we're talking spinal cord, and we're talking about applying very light touch in a gentle manual manipulation way that addresses the entire central nervous system. It changes the way in which the synapses, or the connections where the nerves come together in the brain, it changes that function and helps to normalize it. So no matter what type of seizure, no matter how long the individual has had it, I worked with a college professor who had had seizures since he fell off the roof, horsing around at the age of 9. He'd had 5 different seizure medications and was able to get his PhD on those 5 medications. And when we started doing craniosacral therapy, he eliminated all the medications with the exception of one. And he said, I can't believe that I got a PhD on all those meds, because the medications dampen down the signals. They dampen it down, they slow the brain. Some of you may have a child with seizure disorder, and you've experienced that yourself. You've watched how your child slept all the time. Doctors now, the neurologists, are shifting the medication, and there's been a great deal of improvement in that whole world. So we need to be part of a team working for that child or that individual with seizure disorder. And we can do that very easily. Many neurologists now refer to me here doing craniosacral therapy for that very reason. When I lived in the Midwest and I had my clinic there, people came from all over, and they still do, because seizures can change. And in all the years that I've been treating them, there have only been 2 cases out of hundreds, 2, that I didn't feel like I really could help. And those individuals both had very abnormal brain development. One in particular had 2 right hemispheres and 2 left hemispheres, was extremely low tone, even at the age of 12, could not sit without being sat up and propped, was reliant on help in all areas of daily living, feeding himself, going to the bathroom, bathing, dressing. Speaking was very slow to come, very labored, and only a few words, but very intelligent boy. So there's only been 2 in all those years. It's very helpful. So that seizure disorder, that comes along oftentimes with cerebral palsy, but not always. Let's talk a little bit more about cerebral palsy. So we've talked about it as being a brain bleed or anoxia, the lack of oxygen to the brain, and it being kind of a catch-all terminology. But there are other things that can then be called or classified as that non-progressive brain injury from birth to 18. What about if we have a scenario where a 2-year-old falls into the pool and has near drowning and suffers a lack of oxygen for quite a while, 7 minutes, 9 minutes, enough to lose brain tissue? What about those kinds of cases? Can craniosacral therapy help with that? Well, once again, it can help with the quality of life. Once we've lost brain tissue, there's a lot of that we can't get back. But what we do know about the brain is it has a great deal of what we call plasticity. And what that means is that the brain has the ability, when one area is damaged, to take over with other areas and create new neural pathways. And we also know that up until about age 10, we have all of these nerve potential connections hanging out there and waiting. It's kind of like the old exercise thinking that what you don't use, you lose over time. Well, that's true of brain function too. So we know that we have a large window up until about age 10 where we can get more of those connections to be made. And that applies to a child who's had a near drowning. What about shaken baby syndrome? That's another traumatic brain injury, if you've listened to another segment. So, yes, that can be helpful as well. What about, we have a situation, I'll give you another example. A girl who was 12 years old. Her daddy was a state trooper, and the family was in his work car. They were in the state trooper car. It was on a Sunday, and they were hit by another automobile. The impact was directly on this girl, on her side, in the back seat. So she ended up with brain injury. I started treating her. This was when I was in the Midwest with my clinic up there. She started making progress in school. And later on, I continued to treat her. I encouraged her to come here to the Upledger clinic and go through an intensive program where she got therapy all day, every day, for 2 weeks by multiple therapists working at the same time. And she continued to make more and more gains. Now, was she ever back to being the bright 12-year-old that she was at the time of the injury? No. Did it improve her quality of life dramatically? Yes. CranioSacral Therapy, because it's a non-invasive manual manipulation designed to address the central nervous system in its entirety through the entire body, is a great way of positively impacting neurological function, whatever the cause of the problem may be.